Our sincere apologies for starting this briefing late. However, I welcome you to the national briefing of COVID-19 Presidential Task Force for Monday, the 15th of March, 2021. 8 days ago, members of the Presidential Task Force received their first jabs of the Oxford AstraZeneca vaccines. Since then, the Federal Ministry of Health and its agencies have proceeded to roll out vaccines to the states. The Honorable Minister of Health and the Executive Director of the National Primary Healthcare Development Agency will brief you on the status of vaccine administration across the states of the Federation. Over the last few days, reports from all over the world have focused on the safety and side effects of the AstraZeneca vaccine that is currently being rolled out in Nigeria. The Nigerian authorities have tested and authorized the use of the vaccines because it is safe and efficacious. I believe the Honorable Minister and the ED, National Primary Healthcare Development Authority or agency, would elaborate on that. I, however, wish to reassure you that the government of Nigeria shall always prioritize the health of its citizens. The discussions with the KLM and the Emirates Airlines are still ongoing on the issue of pre-boarding testing for passengers whose final destination of travel are in their home bases. KLM will resume outbound flights from Lagos from today, the 15th of March 2021, without RTD testing, while a letter has been written to the Emirates Airlines to suspend flights with effect from midnight Wednesday, 17th March 2021. However, we will continue to engage with discussions to find resolution to the matter amicably. I believe the Honorable Minister of Aviation, who is here with us today, will throw more light on these issues. You will recall that at the beginning of the ban on international and domestic travels, airports in Nigeria were locked down. The major concern for the ban on international flights was to prevent importation of the virus. The ban has since been lifted after necessary infrastructure and personnel and systems were put in place in Lagos and Abuja airports in order to further energize the economies of states in the northwest, south, and southeast. A timetable has been prepared for the reopening of Kano, Port Harcourt, and Enugu international airports. The Honorable Minister of Aviation or the DG NCAA would update you on this particular issue. The arrival of vaccines has not in any way distracted us from pursuing the national response to COVID-19 as originally conceptualized, which is to test, detect, trace, isolate, and treat. For the avoidance of doubt, the virus is very potent and people still get infected. It is also a fact that the vaccination process has only just begun. It has been reported that some countries are recording a third wave of cases. We urge all Nigerians to recognize that we are not yet out of the woods. Therefore, the Presidential Task Force shall continue to emphasize and promote the strict adherence to the MPIs, which are basically wearing of mask or any facial covering to cover your mouth and your nose, maintaining social distancing, and avoid large congregations, the need to maintain personal hygiene by washing of hands or the use of sanitizers, and except it is very necessary and expedient, stop unnecessary travels. As at 14th March 2021, our bed occupancy has reduced to 1.22%, and active cases stands at 13,245. Unfortunately, Nigeria crossed 2,000 fatalities on 12th of March 2021 and now have 2,013 recorded deaths. The Presidential Task Force would like to caution Nigerians on home-based care, as there may not be enough facilities and personnel to manage patients in times of emergencies. It is in this way that concerted efforts have been made to ensure that oxygen is available for patients in all the 46 facilities. I now have the honor to invite the Honorable Minister of Health, the DG, Nigeria Center for Disease Control, the Honorable Minister of Aviation, the National Incident Manager, and lastly, the Executive Director of National Primary Healthcare Development Agency, to brief you on technical developments thus far. I want to thank you for listening and wish you a pleasant evening. Thank you.
Good afternoon, everybody. The chairman of the Presidential Task Force on COVID-19, honorable ministers, Director General and Executive Director, permanent secretaries, and all other officials here present. On the 14th of March 2021, about 120 new COVID-19 cases were recorded, bringing our total number of known cases till date to 160,657 from 1,684,305 samples so far tested, while 145,399 cases have been discharged. We have sadly crossed the 2,000 mark to record 2,013 fatalities in the country. We have also observed a slight increase in case fatality rate in the last few weeks, apparently due perhaps to the fact that patients may be reporting later for treatment than at the beginning. It is my hope that citizens not lose their fear of this terrible disease and not to take needless risk in handling it. Hesitation in seeking help exposes patients to dangers and reduces chances of better results. Those who test positive and feel ill are therefore advised to report to a treatment center promptly. As we have heard, there is space, there is bed space. And persons in home-based care should strictly take advice from case managers. If you wait too long, if you have symptoms, the risk is that night comes, transportation and services are slowed down, and getting to a hospital may prove more difficult than during daytime. The global COVID-19 trend is still not predictable, so we have learned not to trust all the forecasts we hear of, and keep up surveillance at our ports of entry, track and trace, and take public health measures must still all be upheld so that we do not fall into complacency, which may have led to third and fourth waves of COVID outbreak in some countries. It is particularly so and particularly important in view of the outbreak of Ebola in Guinea, which has thankfully not spread further thanks to the support from partners and the vaccination going on there. Otherwise, such outbreaks could complicate things even further for us. Nigeria is happy to now join nations that have started vaccination against COVID-19, and it is the best hope so far for containment of the disease. But let us emphasize strictly, along with all other measures in place. We received a batch of almost 4 billion COVID-19 doses on Tuesday, 2nd of March, through the COVAX facility, who committed to vaccinate 20% of our population, as has been repeatedly said here. We have assurances of 16 million doses coming by the end of this year. Since the rollout on Friday, 5th of March, vaccination has been uneventful, largely, and no adverse health events have been recorded in our country. I'm pleased to say that Their Excellencies, the President and Vice President, as well as strategic leaders who have taken this vaccine, along with frontline healthcare workers, are all doing very well. Their engagement has helped to demonstrate to citizens that the vaccines we received are safe, and all eligible persons are encouraged to take their own when called up, after self-registration or assisted registration or otherwise, so that you are not left out. We are nevertheless very closely monitoring all reports from other countries on all vaccines, including the AstraZeneca vaccine, and constantly in touch with the World Health Organization and all our experts for advice. All states in the Federation have received their own vaccine allocation, except Kogi, that is still waiting for its allocation as soon as the cold chain is fully established in that state. We are in touch with the State Commissioner of Health in regard of getting the cold chain facility fully functional, and the allocation will be sent in there. We commend the CACOVID and state governments for facilitating delivery of vaccines from central stores to their respective states. And I'm also pleased to note that states have commenced vaccination and is going on smoothly. I wish to assure all states and local governments that the support funds that have been promised will be paid as soon as the formalities are complete. I want to urge all states to use existing resources so that there are no hitches in this exercise, and again, the guarantee that the allocations that have been agreed upon, that have been mentioned earlier, as long as they are officially approved and the formalities are done, will be disbursed. The National Primary Healthcare Development Agency has taken pains to make very detailed plans for this phase, from registration to the launch of vaccination and the phase dispensing going on presently. It is important that the rollout be respected, as has been proposed by NTA, and that citizens cooperate in this exercise. So far, we have also enjoyed the cooperation of citizens. We are impressed with their collaboration. Our policy is to leave no one behind who desires to be vaccinated. Safety and security of health workers is key to smooth rollout. Frontline health workers, including vaccinators, must themselves be protected in order to be able to care for us in this pandemic. Private importation of COVID-19 has not yet been authorized due to reports of substandard and falsified vaccines in circulation. The deployment, for now, will be handled by NPACDA or an NPACDA accredited facility only. Organized vaccine administration of this COVID vaccine is an approach that many nations have taken to stand a better chance of monitoring the effect of the novel vaccine, which is still being studied, and for which government, as we have said before, had to give indemnification to manufacturers and suppliers. Therefore, all countries using the vaccine are obliged to report adverse effects to a global platform and add to the body of knowledge on them. It is for the safety of citizens that government takes sole responsibility for acquisition, dispensing, and also monitoring of vaccine use. Citizens should get only trusted vaccines and not fall victim of fake products. Enhanced surveillance mechanisms are in place to promptly report and respond to any development in the course of the vaccine rollout, as well as to continue to attend to reports of any unusual outbreaks in the country. Despite reports that have emerged of adverse effects in some countries, I assure everyone that this vaccine we are using here so far has been safe. NAFDAC is collaborating with WHO and partners to continue to also work with other countries and systems to evaluate other vaccines to be able to add to our portfolio, particularly from the AVAT platform. NAFDAC has introduced a mobile application, the Med Safety app, as a tool to monitor adverse reactions. I urge all persons who have taken a vaccine to use the Med Safety app to report their own adverse reaction to this vaccine. Nigeria is still monitoring the recent Ebola virus disease outbreak in Guinea and the avian flu in 3 states of the Federation, and we can report that there is no loss of control in those areas. With deployment of vaccines, I want to say that we are seeing light at the end of the tunnel, at the end of the COVID-19 tunnel. But we are not yet out of the tunnel. We are still inside that tunnel. Therefore, I want to advise again, adherence to public health measures despite vaccination, even if you have been vaccinated. Those around you may not have been. I advise that you wear a mask, observe your distancing, avoid non-essential travel, avoid crowding and gatherings that bring you into contact with large numbers of persons that you do not know. Thank you for your attention.
Chair of the Presidential Task Force, Secretary to the Government of the Federation, Honorable Ministers, colleagues on the Presidential Task Force, gentlemen of the press, good evening. A very quick update from NCDC so that we cede the time to our colleagues leading the vaccination efforts. To start, over the last 2 weeks, there's been an incredibly significant event receiving our first vaccines from the COVAX facility. Obviously, our sister agency, NPACD, has begun this rollout, and I'm sure that my brother, the ED, will provide a detailed update. Really excited for all the healthcare workers across the country that will be getting their vaccines over the next few days, and this will really provide them really a lot of hope and reinvigorate their efforts as they go ahead with the work they do on our behalf. So today I will just focus on some of the public health, rest of the public health response. We all know that the COVID-19 pandemic still has a long way to go. Although the number of cases are declining globally and in Nigeria, there are also countries that thought they were out of the woods, have also started their vaccination efforts, but are now seeing a resurgence of cases. So we must keep our eyes on these things. For example, in Brazil, as you know, there's a new variant that's causing a lot of challenges, the P1 variant, and we've seen a really steep increase in the number of cases. Today we heard that Brazil had the largest number of cases in a single day by any country. This has been reported out of the US for many days prior to today. So we have to keep our eyes on the ball. Safe and effective vaccines are definitely will be a game changer for this response. But we can't drop the ball on all the other things we've been working so hard on, at least not yet. So we'll continue supporting the agencies leading the response at the moment from the vaccination perspective in every possible way that we can. One important way that we'll do this is by starting a small vaccine effectiveness study. This is now happening in many other countries in the world. When you introduce new vaccines, you look at the real world effect in the country where you're rolling out. This is being done, of course, in collaboration with NPCDA and NAFDAC. The protocol was sent to NREC for ethical approval today. So that will be an important milestone as we implement that over the next few weeks, so that if there are any changes in the effectiveness of the vaccine in our context, we're in a position to pick it up so that we don't drive blind. The other area we've been supporting our colleagues a lot on is on the risk communications and making sure that Nigerians really understand the benefit of vaccines. And I really thank members of the press, especially all of you, for the huge role you have played and the role that you have to continue playing over the next few months. Secondly, one of the challenges that we have faced over the last few months is the issue of fake COVID-19 test results by travelers. So in response, we've developed this verification tool, which is going live in the next few days. We are focused on quality over speed. So it's taking a bit longer to develop this tool, but it's now ready to be deployed. And it's really unfortunate because we've really continued to receive reports nearly every day from airport officials about fake results, either coming out of private people's printers at home or various labs potentially across the country. So last week we piloted this verification platform at both international airports currently working in Lagos and Abuja, and we're now confident that we can verify every single result out of a lab, out of a private lab authorized to test in Nigeria. So every airline, every embassy, any foreign country can verify results out of Nigeria, providing safety confidence for aviation industry to keep flying, to keep traffic going. Please, we continue to appeal to all Nigerians. Yes, it's important to have platforms through which we can detect misdemeanors. But of course, the ideal situation is that this doesn't happen in the first place. Any laboratory result received from outside this list will be considered illegal. It's likely that you'll be prevented from travel, and the agencies at the airport might indeed hand you over to one of the security forces at the airports for further action. So please, if you're traveling out of Nigeria and you have a result that you're not sure of its authenticity, it might be in your best interest not to try at all. We're grateful really for the collaboration that has led to this from Port Health Services, NCAA, colleagues on the PTF. This has been 6 weeks of intensive work with the PTF Secretariat that has made this platform possible. Still on travel-related testing, some airlines have also requested for additional tests to be done. We're working with state governments now to register a few labs where this will be done, and once that is ready, the PTF will make an announcement around them. So to conclude, there's really still a lot of work to be done on this response, but as we continue to do this work, we're now really focusing as well on building our lab, our health security architecture for the future. So over the next few days, we'll be commissioning a few new labs across the country, efforts that started last year with support from extra resources from the Presidential Task Force to make sure that if we're ever in this type of situation again, we're not starting from scratch, counting the number of labs. That effort will continue over the next few months, probably years, to make sure that we're in a much better, stronger position to protect the health of our people. So thank you very much.
Gentlemen of the media, good afternoon. Thank you very much, Mr. Chairman and my colleagues. So the airports were closed at some point, and the reasons are known, and it takes a lot to open them. We've since opened Abuja and Lagos. There has been agitations for us to open Port Harcourt, Enugu, and Kano, and of course it takes a tremendous amount of work and preparations in the management of this virus to be able to open up other areas of entry. We do only at the time what will be good for the management of this virus. It's very painful, especially for us in civil aviation. We have our airports closed and they are a direct source of income. We were finding it extremely very difficult to pay salaries. So we're shutting down those airports with a great deal of pain. And when we shut down the airports, we have to keep them running, otherwise the facilities in there will get dilapidated for lack of usage. So it is in our interest to keep them open. Unfortunately, we couldn't because of our collective health and collective goods of the country and those that do business with Nigeria. So now that we have most of the things in place, due to all of the work that have been done by the PTF, we will be opening Enugu on the 3rd of May, 2021. We'll be opening Kano on the 5th of April, 2021, and Port Harcourt on the 15th of April, 2021 for international flights. All of the things that will be in place will be put in place to ensure safe operations before the said dates. Now regarding KLM and Emirates Airlines, at the time that we resumed flights, these two airlines made demands that there will be PCR tests for passengers within 72 hours of their flights, and there will also be an antigen rapid test at the airport, and also a PCR test on arrival Dubai. This Nigeria considered as country-specific, discriminatory, and not acceptable. It is devoid of any scientific reasoning because the virus itself will incubate at least within or after 72 hours. So it sounds not correct for you to take a test within 72 hours PCR and take a rapid test before flight, and 7 hours later you take another test. You are likely to show negative. And the reasons advanced at the time was that the PCR results are being faked. Well, PCR results are also faked in so many other countries, including the countries in question. However, the PTF struggled to install what you just have heard, that you can verify the authenticity of any PCR test conducted. And therefore, we give the options to the two airlines. You can either have a PCR test 72 hours before departure or within 72 hours before departure and have a repeat PCR test on arrival, or you have a rapid test before departure and have a PCR on arrival, but not a combination of all of the three, because it doesn't make scientific sense. It makes facilitation of passenger very cumbersome. It makes our work very difficult, and passengers are going through unnecessary hardship, which wasn't acceptable. I'm happy to state that KLM, then they started, both KLM and Emirates, to carry only inbound passengers and not to take outbound passengers for the reasons they advanced, which didn't make sense. So we give them the option to do what we believe is safe and correct, and KLM has accepted to bring passengers in and out with the conditions that we agreed upon, i.e. to have a PCR test within 72 hours. Emirates didn't accept that position, so we have asked that Emirates will be banned from operations midnight Wednesday, and that has been communicated to them since yesterday. However, like the chairman has said, if they will come back to us to resume like KLM had done, then they will also be allowed to continue. Otherwise, the status quo remain, and they will be banned from both inbound and outbound flights. However, KLM have accepted to start instanta, immediately. Therefore, they are allowed to do so. Thank you very much indeed.
Mr. Chairman and Secretary to the Government of the Federation, honorable ministers here present, members of the PTF, ladies and gentlemen of the press. Let me start by just saying that the arrival of the vaccines is something that is very good and exciting for the response, in the sense that a combination of the vaccines and the non-pharmaceutical interventions can help us see the light at the end of the tunnel within a very short period of time. However, we have suffered a major setback in the last few hours regarding the taunted safety and efficacy of the Oxford AstraZeneca vaccine. We have seen in the news how some countries have deferred the usage of this vaccine or have suspended its use. The list of the European countries is growing. However, it is very reassuring to see that the regulatory agencies in those countries have continued to emphasize that the vaccine is safe and that the incidence of blood clots reported in the patients is not higher than the risk of blood clotting in people who are not vaccinated. So that is really something reassuring. It is also heartwarming to see that WHO has again issued statement. Over the last 3 days, WHO has been bringing out statements regarding the safety and efficacy of the Oxford AstraZeneca vaccine. It is therefore important that we take this science, we take this information seriously, and that we use it as a guide towards the implementation of our programs. The Nigerian health sector, the Federal Ministry of Health, the National Food Drug Agency Control, NAFDAC, and the National Primary Healthcare Development Agency are working also not only to reassure Nigerians, but also to make a determination and to continue to get information regarding any side effects that people are experiencing in this country. So, with this, I will say that the available information from clinical trials has shown that the vaccine is generally safe and efficacious, and that it has an efficacy of about 70%. The side effects are usually mild, which include fever, cough, symptoms of cold, and maybe the general feeling of unwell. Any symptoms that have persisted for more than 24 hours should be reported through the right channel at the state level, through the Primary Healthcare Development Agency and the state case managers. The PTF also wishes to warn citizens not to capitalize on the arrival of these vaccines into the country to flout the laid down COVID-19 protocol, which include the use of face mask, observance of physical distancing at public events, and we urge the state governments to intensify efforts of enforcement of health regulations signed by Mr. President until we reached a certain point where we are comfortable with the level of immunity in the country. It is sad to note that some people of very high positions, particularly some political and religious leaders, have used this opportunity to provide misinformation to the public regarding the response and also the efficacy of the vaccine. We urge them to please contact the relevant experts in the field before they make these pronouncements. Any pronouncement by a responsible or political or religious leader to his gathering should be based on the science and the fact and not just what they feel at that moment. Nigeria has continued to roll out policies that will protect Nigerians in terms of the COVID-19 response. We're establishing a verification system for the laboratory results that are for people who are arriving into the country to make sure that people are not coming in with fake results. People who come in with fake results are likely to be positive and can also infect other people. So part of the measures we are taking is to put out a verification system that can help us identify such fake results. The DG NCDC has already mentioned the onerous task that has been undertaken to ensure the results verification platform for passengers going out of Nigeria that has been established with private labs. For purpose of emphasis, let me say that for people traveling out of Nigeria, we have accredited private laboratories, and only these laboratories have been registered on the verification platform. Therefore, if you bring a test result, even if it is from a government accredited laboratory, it will not be recognized by the portal. It is not fake, but you will not be allowed to travel because your result cannot be read in that portal. We also, I just want to urge also the states to ensure that there is coordination of the response and that the arrival of the vaccines do not in any way hamper the public health containment measures that they are putting in place. We can only win this war if we put in the combination of the public health containment measures and that of the vaccine rollout in the country. Thank you.
The chairman of the Presidential Task Force and Secretary to the Government of Nigeria, the members of the task force, distinguished ladies and gentlemen, good evening, compatriots in the media. I want to join others in welcoming you to this week's event of our regular briefing on COVID-19 vaccination in Nigeria. As you are aware, the AstraZeneca COVID-19 vaccines have been distributed to all states except Kogi State. The first phase of our vaccination will focus on frontline health workers and others on essential duties in the next few days. Kogi State was not supplied with the vaccine because their cold store is still under repairs following vandalization during the NSAS protests. Similarly, all state governors apart from Kogi have launched the vaccination program in their states. As you must have seen on the media, these launches also involved public vaccination of the governor and strategic leaders, again to underscore the confidence in the safety and effectiveness of the vaccine. As part of the vaccine launch in the states that occurred last week, over 8,000 Nigerians have been administered the vaccine thus far. We have not received any official report of serious adverse events from any of those who have been vaccinated. Of course, mild side effects such as pain and swelling at the site of the vaccination are expected. This is normal with any vaccination, and we are working closely with NAFDAC to monitor any unusual adverse reactions to the vaccines. In addition to other measures that we have outlined in our TEACH strategy for the vaccine rollout, NAFDAC has introduced the MedSafety app for people to download and install on their Android and Apple devices to report any adverse events following immunization, AEFI. I want to assure Nigerians that the federal government, through the Presidential Task Force on COVID-19, is firmly committed to safe and successful COVID-19 vaccination in the country. No safety and efficacy standards has been compromised in the decision of the government to introduce the Oxford AstraZeneca COVID-19 vaccine. The vaccine was approved for emergency use listing by the World Health Organization and was tested and certified as safe and effective for use in Nigeria by NAFDAC. Our cold chain stores are very efficient and powered to ensure that optimal temperatures are maintained in the distribution of this vaccine to the states and LGAs throughout the country. It is important to note that none of the approved brands of COVID-19 vaccine is inferior. Understandably, the Oxford AstraZeneca vaccine costs relatively less than the other available brands of COVID-19 vaccines. However, this is not because it is inferior. It is because AstraZeneca, which partnered with Oxford to produce the vaccine, decided and announced that they will not be making profit during this pandemic. So from a humanitarian point of view, they decided that they will sell at their cost price. This is the reason for the relatively low cost of the AstraZeneca vaccine. It is not because it is inferior in any way. As you very well know, the AstraZeneca vaccine is being used in many parts of the world. Even after the rollout suspension by some European countries over certain concerns raised, the World Health Organization and its Vaccine Advisory Committee has advised that there is no reason to stop using the Oxford AstraZeneca vaccine. Similarly, the UK's regulator has also determined that evidence does not suggest that the vaccine causes blood clot.